DEA issues a warning: the dangers of Xylazine. DEA's recently warned about Xylazine, a sedative primarily used on animals that is now being mixed with other opioids, such as fentanyl, to produce a more intense and longer-lasting high in opioid addicts. This video discusses Xylazine's hazardous effects, which can lead to severe necrotic skin wounds, tissue death, or amputation. This video will explain Xylazine, why it is dangerous when combined with fentanyl, the challenges of addressing Xylazine misuse, and what to do if you suspect a Xylazine overdose. The DEA issued a public safety alert about Xylazine. The DEA's warned that this sedative, used on animals and not approved for human use, is being combined with other opioids, such as fentanyl, to produce a more potent high in opioid addicts. The DEA has advised medical personnel and law enforcement to use extra caution when encountering people who have taken these mixtures. Xylazine is a powerful veterinary tranquilizer approved by the U.S. Food and Drug Administration, FDA, for use in horses, cattle, and other animals. It has an anesthetic effect that can sedate large animals with minimal risk of injury or death. Xylazine is not intended for human use. When Xylazine is mixed with other opioids, such as fentanyl, it can create a more intense and longer-lasting euphoric high. Xylazine can trigger severe side effects in humans, such as severe necrotic skin wounds that can lead to tissue death or amputation, withdrawal symptoms, and possible interference during treatment for opioid addiction. Xylazine amplifies the adverse side effects of opioids, making them more powerful and longer-lasting, which can cause irreversible physical damage and even death. Addressing Xylazine misuse will be no easy feat due to the following reasons. First, since Xylazine is not approved for human use, medical personnel and law enforcement must become more familiar with it, making it difficult to diagnose and treat. Second, it is challenging to identify when Xylazine is being misused because it's generally hard to know what substances are involved in a substance overdose incident. Third, Xylazine isn't an opioid, so it doesn't respond to traditional opioid addiction treatments like naloxone, an antidote for opioid overdose, making it hard for doctors to treat patients using Xylazine and other opioids. If you suspect you or someone you know has taken an opioid mixed with Xylazine, seek medical help immediately. Experts recommend giving naloxone to anyone who shows signs of opioid overdose. It is also essential to seek professional help if you are struggling with opioid addiction or know someone who is. Opioid addicts and their families must be aware of the dangers of Xylazine to protect themselves from serious physical harm and even death. The White House views Xylazine as a severe threat to public health and safety, and the DEA has warned about its misuse. Everyone must know the dangers associated with Xylazine in combination with opioids. By knowing the facts, we can all work together to reduce the risk of Xylazine overdose and ensure that more lives are saved. If you or someone you know suffers from opioid addiction, seek professional help today. Many resources and treatment options are available to help those struggling with opioid use disorder. Suboxone Clinic can help those suffering from opioid addiction. Don't wait any longer. Take that first step. Contact us today to begin your recovery journey.